Namaste बिटिया, हमेशा खुश रहो बिटिया. Myself, JV and Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this lecture, we are going to demonstrate the lymph node examination. Whenever a patient is coming to us, how we can do the lymph node examination and what are the various lymph nodes that could be palpated in a particular patient. So, we are going to discuss about, there are lots and lots of lymph nodes in the body, but there are certain lymph nodes that are important lymph nodes and they are significant and that could be observed in a particular patient. This examination is usually done in the OPD settings, but this is an educational video. Therefore, we have just taken a subject where we can do the examination, the lymph node examination of a patient. Therefore, the conditions are not that of the hospital, but this by this video you can easily elicit what are the common lymph nodes that could be examined and how to examine those lymph nodes. So first of all, you have to take the consent of the patient. Here this is the subject, not a patient. So क्या मैं आपका examination कर सकता हूँ, lymph node examination? So first of all, we have to take the consent of the patient. So थोड़ा सा आप chair को यहाँ ले लीजिए. So whenever you are doing the lymph node examination, you have to use the three finger methods, and you have to examine in the rolling method. There are certain lymph nodes that we are going to examine. One by one, I will be telling you the examination of each one of them. So first of all, you have to sit behind the patient, and then we have to use our three fingers for the examination of the lymph nodes. First of all, we have to check for the, this is the auricle or the ear. We have to do the pre-auricular lymph node examination in the circular motion using three fingers. First one is the pre-auricular, then we have the post-auricular behind the auricles. Then we have occipital lymph node examination. So pre-auricular, post-auricular and occipital. These are three lymph nodes that we are going to examine just in the rolling movement. Pre-auricular, post-auricular and occipital lymph node we are checking for. Then we will go to the submandibular lymph node. These are the submandibular group of lymph node that we are going to examine. This is the submental group of lymph nodes. Then we have cervical group of lymph node. This is the sternocleidomastoid muscle, and then we have anterior cervical and posterior cervical group of lymph nodes. So we have discussed pre-auricular, post-auricular, occipital, submandibular, submental. Then we have anterior cervical and posterior cervical. Then we come to supraclavicular lymph node. The significance of this supraclavicular lymph node is, in case of abdominal malignancies, the left supraclavicular lymph node will be enlarged. So we will be checking for the supraclavicular lymph nodes and infraclavicular lymph nodes. Then we are going to check for the axillary nodes. This is the axilla, and we have 5 group of lymph nodes in the axilla. We have anterior group of lymph nodes, we have posterior group of lymph nodes, we have medial, lateral and apical. Medial group of lymph node is also known as central group of lymph nodes. Then we come to the epitrochlear group of lymph node. This site is the epitrochlear group of lymph nodes that we are going to examine. Then coming down, we will be looking for the inguinal group of lymph nodes. The inguinal group of lymph nodes will be checked while lying down in a patient. Then we have to check in the inguinal fossa, and here we will be finding inguinal lymph node, and then popliteal group of lymph nodes behind in the popliteal fossa. So these are the common group of lymph nodes that we are going to observe. Let me again revise you. This is pre-auricular lymph node, post-auricular lymph node, occipital lymph node. Then we have supraclavicular, infraclavicular. We have submandibular, submental. Then we have axillary group of lymph node, we have epitrochlear group of lymph node, we have inguinal, and we have popliteal group of lymph node. These are the common lymph nodes that we are going to observe in the patient whenever a patient is coming to us, and then we have to assess whether the patient is having any sort of infection, any sort of infective disease that will be leading to the development or enlargement of the lymph nodes. There are also other group of lymph nodes that we can observe, but these are the main lymph nodes that we need to examine in a particular patient. So at the end, we have to thank our subject for providing us an opportunity to show you the common lymph nodes that could be observed. So thank you very much. So these are the various lymph nodes. In the next lecture, I will try to show you this examination of this lymph node in the hospital setting. So this was all for today. Thank you very much. Have a good day.